Okay, video number 3. My name is Jessica Taddeo. I'm here with my patient. We are going to be doing an examination of the musculoskeletal and neurological systems. And I'm going to go ahead and wash my hands, greet my patient. Okay, hello sir. My name is Jessica Taddeo. I am the nurse practitioner student. I'm going to be doing an examination today of your musculoskeletal and neurological systems. I'm going to go ahead and start right in with the musculoskeletal system. I'm going to go through all your joints and I'm going to inspect, palpate, and perform range of motion on all of them. You ready?
Yes.
All right, let's start with the TMJ. Go ahead and open your mouth and close your mouth. Okay, and then stick your teeth out and push them in. Good, so I've inspected the joint for any warmth, swelling, or tenderness, and I've palpated and also assessed range of motion. The next is the shoulder. I'm going to inspect the shoulders for any swelling, deformities, tenderness, anything like that. I'm palpating along the clavicle and along the humerus, and then back along the scapula for any bony deformities or tenderness. And now we're going to do range of motion of your shoulder. So we're going to do extension, raise your arms up, and then flexion, you can put your arms down, and you're going to do abduction, put your arms away from your body, and adduction, put your arms towards your body. Okay, and now I want you to roll your shoulders forward and roll them back. Okay, internal, external rotation, and go ahead and scratch your neck and do it on the other side. Go back up from underneath and go back up from underneath on the other side. Okay, and moving on to the elbows, I'm going to inspect the elbows and I'm going to palpate for any tenderness, especially along the medial and lateral epicondyles. And I'm going to do range of motion. Let's do flexion, raise arm up, extension, and then we'll do supination. Turn your arm like this, palm down, and then turn it over, palm up, both arms. Do up, down, and then palm out and palm up. Good. And now moving on to the wrists and hands. I'm going to inspect the joints of the wrists and the hands. I'm looking for redness, warmth, swelling, any tenderness. In arthritis, you can get like those Herbadin nodules in the fingers. I'm going to palpate the bones of the wrist and the metacarpals of the hand. I'm going to palpate the MCP joints. I'm going to palpate the PIP joints and the DIP joints on both hands. Good. And now we're going to do, of the wrists, we're going to do flexion, extension. We're going to do abduction away from your body, and then towards your body, adduction. And then fingers, spread them out, put them together like this. Pay attention to me. Okay, and then squeeze your hand and let it out straight. Okay, and now we're going to do the neck and the spine. If you could please stand up for me and turn around. Step over here for my camera. Okay, I'm gonna pull your shirt up so we can inspect the vertebral column. Through the cervical spine, the thoracic spine, and the lumbar spine. I'm assessing for any obvious deformities. I'm going to palpate along each of the vertebrae. I'm palpating for any tenderness, any step-offs, any crepitus, or anything like that. I'm looking at the normal curvature of the spine, and I'm going to palpate the paravertebral muscles for any tenderness, and that appears normal. Let's check range of motion of the neck. If you could please, let me just adjust this camera a little bit. Bend your neck forward, touch your chin to your chest, okay? Bend your neck backwards, All right. Touch your left ear to your left shoulder. Okay. Touch your right ear to your right shoulder. And now kind of rotate your neck, like look left, look right. Okay. And for the spine, bend forward. Okay. And bend backwards. Okay. And then twisted your hips. Good. Okay. Normal range of motion throughout the spine. You can put your shirt on and go ahead and lay down for me.
Face down or face up?
Let's do face up first, please. Okay, I'm going to do the hips. I'm going to inspect the hips. I'm going to palpate the joints for any abnormalities, tenderness, deformities. We're going to do flexion, internal, external rotation, and then we're going to do abduction and adduction across the body. And again on the other side, let's do flexion, internal, external rotation, adduction and abduction. Full range of motion in the hips except turn over onto your tummy, please, real quick. And lift your leg up off of the couch at the hip. Okay, and on the other side. Okay, good. You're back on your back, please. That's really gonna be hard. All right, next is the knee. We're gonna inspect the knee for any swelling, redness, warmth, tenderness. We're going to palpate the knee, looking for any joint effusion or any warmth to the area. And we can do range of motion here as well. Deflection, extension, internal, external rotation. And again, flexion, extension, internal, external rotation of the knee. And finally, the ankle. We're going to inspect the ankle and look for any swelling, redness, or warmth. We're going to palpate the ankle for any tenderness or bony deformities, and then I want you to point your toes down like a gas pedal. Point your toes up to your nose. Okay, and then turn your toes in. That's out. Turn your toes in and turn your toes out. Okay, and go ahead and sit up for me. I'm going to have you start with cranial nerve 1 or mental status. I'm going to move on to the neurological examination. So we've looked at all the joints in the body. Should also assess muscle strength. Go ahead and push up on my hands for me. Okay, and push up with your arm and push down. Good. Push up with your arm and push down. Good. Push up and push down. Push up and push down. Okay, and on your feet. Push down. Okay, and pull up and push down and pull up. All right, muscle strength. Can you please tell me the date today, sir?
2020.
That's the year? What's the date?
October 5th.
Okay, what day of the week is it?
It is a Monday.
All right, where are we?
Florida.
What city is this?
Kissimmee.
And what street do you live on?
Stonington Run.
How old are you?
40.
Okay. Let's test cranial nerve number 1, the olfactory nerve. Close your eyes. What does that smell like?
Mint.
Okay. And eyes are still closed?
Yep.
What does that smell like?
Coffee.
Okay. Cranial nerve number 2, the optic nerve. Go ahead and with both eyes, read to me the smallest line that you can see.
428739.
Okay. 2020. Vision has improved since the last examination. Go ahead and look forward for me. I'm just going to check your pupils. This is, again, cranial nerve number 2, the optic nerve. Pupils are 3 millimeters and reactive to light. I'm going to assess extraocular movements. Look at my pen light and follow it with your eyes. Up and down, way up there, way down there, and convergence. Okay. Extraocular movements are intact. That's cranial nerves 3, 4, and 6. Cranial nerve 5 is the trigeminal nerve. Clench your teeth for me. Okay, and again, open your mouth. All right, and I'm just going to assess sensation on the face. Close your eyes. Does this feel soft or sharp?
Soft.
Soft or sharp?
Sharp.
Soft or sharp?
Soft.
Soft or sharp?
Soft.
Soft or sharp?
Sharp.
Okay. That was 5, 6, 7 is the facial nerve. We are going to have you close your eyes tight, 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 tight. Okay, raise your eyebrows up to the sky and puff out your cheeks. Good, and smile big, big, big for me. Good, all right. And we're assessing for any facial asymmetry or drooping. And the auditory nerve is next, which will assess hearing. I'm gonna do the whisper test. I'm gonna whisper something in your ear, sir, and tell me what I say.
3, 2, 1.
Okay, and I'm gonna block this other ear and tell me what I say.
10, 9, 8.
Okay, whisper test is intact bilaterally. That was 8, so 9. And 10 is the glossopharyngeal and the vagus nerve. I'm going to have you open your mouth, say ah, looking at the movement of the soft palate. And if I had a tongue depressor, I would check his gag reflex. It's intact. Number 11, spinal accessory nerve. Shrug your shoulders. Good. Turn your head to this side. Turn your head to this side. Good. And the last one, hypoglossal, cranial nerve number 12. Stick your tongue out. Move it left. Move it right. Move it up. Move it down. All right. Cranial nerves 1 through 12 are intact. Next is the motor skills. Let's do finger to nose. I'm going to have you take your index finger of your right hand, touch your nose, touch my finger, touch your nose, touch my finger. Switch hands. Touch your nose, touch my finger, touch your nose, touch my finger. And let's do rapid alternating movements. Put your hands on your thighs, flip them over. Do it fast, 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 fast. Okay. Good. Excellent. Let's check your walking, your gait. Stand up for me, please. We're going to assess posture. I'm going to have you walk over there.
Walk over there now.
Yeah, just walk. Normal. Turn around. Walk back on your tippy toes. Turn around. Walk back on your heels.
That's how it should.
And then turn around. Walk back heel to toe.
Oh, God, this is the worst.
Okay. Stand with your feet together, arms out, eyes closed. This is the Romberg test. See him? See me? If your patient's unsteady, you gotta be ready to catch him. I should be ready to catch him. Okay, good. All right, negative Romberg test. I'm also just looking for any involuntary movements. You can sit down. Involuntary movements like twitching or muscle tremors or anything like that. Let's assess sensation. Okay. Close your eyes. Is this soft or dull or sharp?
Soft.
Okay. Soft, dull, or sharp?
Dull.
Soft, dull, or sharp?
Sharp.
Soft, dull, or sharp?
Sharp.
Soft, dull, or sharp?
Soft.
Soft, dull, or sharp?
Sharp.
Okay. And I could go through the lower legs as well, but for the sake of time, let's just keep moving. Stereognosis. Go ahead and close your eyes. I'll put something in your hand. What is that?
Paperclip.
Okay. Fantastic. I'm going to put one more thing in your hand. What is
Pen.
that? A pen. Good. I'm going to do graphesthesia. Again, keep your eyes closed. I'm going to draw something in your hand.
A T. X.
An X, okay? And,
Circle.
okay.
3. 4. 4. I don't know what the hell that
That's
is.
an
A.
A.
Okay.
Okay. Graphesthesia. Let's do point localization. Close your eyes. I'm going to touch you with my finger, and you point to where I touch you. Okay, and let's do proprioception. Proprioception, I'm going to move your finger up or down. Close your eyes, and you tell me which way your finger's going.
Up. Down. Up. Up. Down.
Okay, and we would repeat the same thing on the toes. We did it. All right, musculoskeletal and neurological systems have been examined, and my patient is alert and oriented ×3. Speech is coherent and appropriate. Mood is irritable at best.
On a Monday.
On a Monday. And cranial nerves 1 through 12 were tested and are intact. Muscle strengths are 5 out of 5 throughout. And motor skills, finger to nose, rapid alternating movements. Normal gait is steady on his toes, heels, and normal gait. Sensation is intact. Stereognosis, graphesthesia, point localization, and proprioception, all within normal limits. The only other thing I didn't do, and I forgot, is...
You made me say 99 more fighting.
No, I'm not doing 99. That's respiratory. This is you hate this too, because I swear he has like hyporeflexia, or he can't relax enough to like let me, I know, yeah, become the Jello. So I'm gonna assess your reflexes. Okay. Brachial, triceps. Okay, I'm going to assess the patellar reflexes. My couch isn't tall enough for him to hang his leg, but
Pillow like that?
yeah. No matter, I can't get him to do it. Can you hit yourself where it would make you do it?
I thought it was like right in here, right?
It's like just below the patella, right there. But seriously, he has no reflexes. Again,
Touch this thing.
and yes, it's right here. I got a little movement out of that one. Then I'm whacking him and it hurts, but. Yeah, and then Achilles. Oh, turn this. I don't know. When I do my own hair, give me that pillow. Let me put it like here. Like I can do my own reflex, like easy. I can tell exactly where it goes. You know, hyper reflex. I'm not kicking it on myself. It like actually just does that. But I can't make him do it. I have no idea. I had to practice on my son. Although he's so ticklish, he can't deal with it. All right. That's it. Everything's been assessed. Thank you. Say goodbye.
Bye.